Okay. I can't open up the video. Can someone let me unlock the video, please? You cannot start your video because the host has stopped it.
I have the same issue.
Okay.
Okay, Mona, we're leaving.
See you later.
Okay. That's it. We're in good hands. Lindsay and Matt can take care of this anyway. This is.
No, we need you guys.
Totally.
I'm redundant.
I agree. You guys got
Don't
this.
leave us.
Work in the
Don't leave
prom.
us.
Work in the prom.
Okay.
See, look, we're modeling how to stay calm and manage our anxiety.
I'm totally calm. I want to leave. I had a long day.
If we weren't a state apart or two apart, then we could just go grab our drinks and watch the webinar.
Oh, wouldn't that be fun? Mona, where are you
Right?
now?
I'm in Boston, yeah, outside of Boston.
Definitely want to drink.
This
There's
is
so much
this is
traffic,
good for
by the
all
way,
of our
Matt.
attendees to hear you guys. It's good.
Okay, well, that's good to know that everyone's listening to our call.
Yes,
our
they
last
are.
call.
Try now. Oh, there we go.
Ah.
Hi, Harold.
Here I am. Hi.
Mona?
I'm working on it. Here we go.
Hey, Mona, forget the drink. Let's start talking.
Let's talk about some fun stuff.
Great
Back to
see you all.
school. How lucky that we don't have to go to school anymore, right? Okay.
Great to see you all. Although being a parent of a kid going back to school is can be its own tall task. Glad to see your faces, and glad to welcome all of our attendees to tonight's webinar. Really grateful for everyone for joining us this evening or this afternoon. My name is Matt Beal. I'm a child and adolescent psychiatrist. I'm the chief medical officer at Fort Health and also professor of psychiatry and pediatrics at Georgetown University Medical Center. This webinar that you all are joining this evening is part of an ongoing series of sessions that Fort Health is hosting in partnership with the Child Mind Institute. Each month we get together and we bring together clinical leaders for discussion about an important topic that affects our children's mental health. Our goal is to provide parents, educators, primary care doctors, all of the adults in children's lives with actionable evidence that's based on clinical experience and scientific evidence. After we took a brief break for the summer, we're now back with a topic that I'm going to assume is relevant to many parents out there. And I know it's relevant to me. Back to school stress and anxiety that both students and their families can feel at this time of year. For this topic, we're really happy to welcome our friend and colleague, Dr. Mona Potter, a child and adolescent psychiatrist. Mona is the co-founder and chief medical officer of InStride, a leading provider in treating acute anxiety disorders and obsessive compulsive disorders in children and adolescents. Mona is also clinical faculty at Harvard Medical School and helped to start the school consultation program at McLean Hospital as part of Harvard. She's a widely recognized expert in school mental health and in treating anxiety disorders in kids. Thanks for joining us, Mona. I'm also joined by Dr. Harold Koplowitz, president and founder of the Child Mind Institute, and Dr. Lindsay Henderson, the clinical director at Fort Health. So in the last few weeks, over 50 million students across the country have returned to school. This is an exciting time of year. It can also be a very stressful time of year for many children and their families. According to a recent Harris poll, over 70% of American parents say that their children experienced challenges last school year. And as a result, another survey that was done by the National Parent and Teacher Association, PTA, found that over half of parents are worried going into this school year about their child struggling emotionally, socially, academically, or in other ways as they start school. For children and adolescents, going back to school means a transition back to an environment that's very demanding. It demands self-control, staying on task, getting and staying organized, sticking to a schedule, separating from parents and from caregivers and siblings, and navigating the complex social interactions that are very much a part of the school environment. These can be challenging tasks for many children, particularly after summer schedules that for many kids are less demanding. And the challenges can be even greater for children who may face mental health difficulties or learning disabilities. Children can sometimes respond to these challenges by feeling overwhelmed. Sometimes they develop behaviors or habits that interfere with a successful transition back to school. School refusal, separation anxiety, frequent headaches or stomach aches, academic difficulties. These are all manifestations for some children who are struggling to cope effectively with the developmental stress of returning to school. At the same time, though, school is a crucial place for kids. Our kids belong in school. School is an opportunity to build the cognitive and social skills that they will need to thrive in the future. And of course, not all stress is bad stress. Feeling anxious, concerns about one's ability to meet new demands, difficulty adjusting to a new school or a new teacher, these are normal and healthy reactions to a new school year. So how can parents know the difference between healthy levels of stress that are likely to resolve with support and a little bit of time from more disconcerting levels of stress and anxiety that require clinical support? Our goal of today's session is to examine some of the top causes for back to school stress and anxiety for both kids and parents. We're going to help to differentiate between normal back to school jitters and signs that a more severe mental health challenge may be present. And we'll provide, we hope, some practical tools to help you and your child manage this exciting but potentially stressful time in a family's life. Dr. Potter, can I ask you to just introduce yourself a bit more and share some initial thoughts about tonight's topic?
Sure. And as I'm still getting on the webinar speed and realizing my own social anxiety has kind of raised in letting all of you get to witness our little pre-webinar chatter. But no, I really appreciate getting to be part of this discussion, Matt and team. Thank you so much for inviting me. As a child psychiatrist and a mom, this topic is both professionally and personally on the top of my mind. We just went through our own back to school transition in my house with all the fun questions. Will they get the teachers they wanted? Will their friends be in their classes? Mourning the loss of sleeping in and those wonderful lazy summer days. Quick intro on me. I'm Dr. Mona Potter. As Matt said, I trained and worked in the MGH McLean Harvard Medical School system for 20 years. Now I'm the co-founder and chief medical officer at InStride Health, where we live and breathe anxiety and OCD management. I've also worked in schools for almost as long as I've been a psychiatrist, and that back to school anxiety spike is real. And it's not just limited to kids, adults feel it as well. We've got changing routines, losing autonomy, constantly encountering new and challenging experiences. It can be really tough, and it can also be exciting and manageable. So I appreciate the chance to come together and talk about it a bit.
So glad you're here. Thank you. We're going to learn a lot from you tonight, and glad to have you part of this club that Lindsay and Harold and I have formed over the last few months. So Harold, I'll ask you now to please reintroduce yourself and maybe share a little bit of thoughts about how parents' attitudes and behaviors may affect children's response to school-related stress at this time of year.
Well, I love being here, but I also love the idea that and the reality that my children are out of school. You know, they're soon going to be, you know, my grandchildren actually go to preschool. So it's so relieving because as a child and adolescent psychiatrist and a parent, and I am the founder of the Child Mind Institute, I can tell you that it's normal to worry about the upcoming school year, particularly, and it's interesting because TV and and streaming shows all make it look like it's so much fun as you go get your school equipment and your new notebook and your new backpack. But the fact is that particularly for a child who struggled last year, the upcoming school year can be particularly stressful. And what's important for parents to know is that they have to maintain calm, especially in front of your kids, because anxiety is very contagious, and you want to avoid passing, that anxiety on, because often anxious parents send anxious kids to school. Very quickly, by the way, a sidebar, I find that when you are dropping your kid off to school and they have that anxious face, your gut feeling is to say, what's wrong? Don't do that. Don't open up Pandora's box right before they go out. Something more helpful, like it's going to be a great day. Can't wait to hear the events of the day when you come home. Because if your kids do sense your anxiety from time to time, that's all right. But what's important is that you want to use those moments to let them know it's okay to feel anxious sometimes, and that big feelings are manageable, but not at the moment of departure or separation. And anxious parents can very often become helicopter parents. They literally want to make sure the right teacher, the right classmates are in the school. Everything is just right. And that can make a kid feel that things aren't just right. Even if you're not displaying your own fears around your child, if you do everything for them and never let them fail or take risks on their own, that can be a way that you increase the anxiety in the long run, because your kid is getting a message that I can't do this by myself. I won't be successful. My most recent book, titled Scaffold Parenting, Raising Resilient, Self-Reliant, and Secure Kids in an Age of Anxiety, really details how instead of rescuing, parents should teach kids different coping tools, and then encourage them to pick the right tool at the right time so they can flourish and take setbacks in stride, because we all know there is going to be failure. You want to provide your kid with a structure, a scaffold, and support and encouragement without accommodating or encouraging their anxiety. So I'm actually looking forward to this, especially since I do not have to send my kids to school on Monday. But I'm delighted to be able to share some of the trials and tribulations that I see every year from my patients, and that I so well remember from my own kids.
Thanks so much, Harold. So many good pearls to come back to there that you've introduced in your comments. Appreciate it. Lindsay, welcome to you as well. Please introduce yourself again, and any initial thoughts you have about this topic, particularly from the standpoint of being a parent sending your own kids off to school as well.
Yes, Matt. I texted Matt my first day of kindergarten and second grade pictures today. It was first day of school today up here in Western New York. So living it, and I'm proud to say it was a good day, at least in the Henderson Mullins household. Hi, I'm Dr. Lindsay Henderson. I'm a clinical psychologist and the clinical director here at Fort Health. I'm super excited to be with my old friend and colleague, Mona. Mona and I worked together for years at McLean Hospital in the Harvard Medical School system in the adolescent unit. And I learned a lot about anxiety from Mona and Dr. Kat Boger. And I'm super excited about what they're building at InStride, because it really is so needed. This time of year, Mona, you and I know that our program, a census would hockey stick, right? The last week of August, no one really needed help. And then back to school meant really the stress came back, and people really started struggling again. And a lot of the treatment that we did there also got to the point of being school avoidant, which is really, really tough and ingrained. And I think one thing to think about is how do we at all cost avoid avoidance, right? And talk about the dangers of avoidance and prevent the sort of ingrained cycles that can really be so heartbreaking for kids and parents. I think also the importance of modeling, like Harold, you just said, modeling. This morning was the first day of school, it was raining. My kids, I could only find one raincoat, right? I mean, waited until this morning to find raincoats. There's 2 children, 1 raincoat. And I got frustrated. My husband and I have developed hand signals to cue each other to, model, tone it down, model your stress, contain it. He had to give me the hand signal because that's just not necessary. Put on a sweatshirt, it's fine. Model, just be calm, cool, collected. And it's hard to do as parents. So excited to continue this conversation with you guys.
Thanks so much, Lindsay. So let's move into some of the details here. I think some of you have alluded to some of the pressures that may drive anxiety for kids and families. It may be particularly for younger kids, fear of the unknown, new teacher, new school setting, new classmates, particularly as kids move into middle and high school, academic pressure or perceptions of academic pressure. Social dynamics start to weigh again on preteen and teenage kids more and more as they anticipate a return to school. Biologically, the schedule adjustment from a summer where they may be able to sleep at a more natural biorhythm to having to wake up very early in the morning. We had a previous webinar about sleep, and one of our panelists talked at length about how screwy school schedules are, where we're dragging adolescents out of bed in the dark when their biological clocks tell them that they want to really sleep a lot longer than that. So that can be a factor. And then worries about the future. Kids know that they're in school to build their skills and capacities for the future. And that can drive feelings of uncertainty and of inadequacy in a lot of kids as well. And we'll come back to talking about mental health conditions more specifically later. But Mona, I'd love to think with you about school anxiety in particular. What are some of the ways that manifests in your experience for kids? And maybe if you can walk us developmentally across different ages of kids, what might show up in that parents or other caregivers are able to observe in kids who are really struggling with back to school anxiety?
Yeah, I mean, and anxiety can show up in lots of different ways, right? It can show up both kind of through behaviors emotionally, but also it can show up physically. And especially with the younger kids, it's oftentimes more the physical that comes up, the kind of the headaches or stomach aches. They might end up in the nurse's office more, or it might come up as separation anxiety, where they just fear being separated from their parents or caregiver, and that's where like drop off can be particularly miserable for everybody involved. Although it can also be more subtle, where they again have like the physical complaints or just kind of delay wanting to get to school, or get to school, go to the nurse's office, and have a hard time actually engaging in class. I'd say kind of when I think about anxiety, it's just, so I want to go back to what Harold said, that we want to be careful to not over pathologize. And that being said, anxiety begets avoidance. And the more we avoid, the stronger it gets. So we don't even so it's not even is it anxiety or is it not anxiety? If you notice that anxious emotions or any kind of emotions are leading to actions that might be different from what we hope the kid would do, your child would do, just pay attention to it and just kind of call it out and try to gently urge them to be brave and approach. So again, I think that sometimes the big question we get asked is, how do we know when we need to intervene? How do we know that it's a disorder, or how do we know that it's anxiety? It's a spectrum and it can come and go. And back to school time is a time where it's normal to have a range of emotions. You can have both excitement and fear at the same time. And so again, it's more about how are the feelings showing up, and what are they causing you, like what behaviors are resulting from those emotions? But if we think about anxiety in general, like there's so many, like we kind of categorize anxiety in a bunch of different ways, and there's so many different kinds of anxiety. I'd say kind of the most common way for anxiety to show up is like generalized anxiety, the separation anxiety I was just mentioning, and then social anxiety. And so with generalized anxiety, you're going to hear a kid express lots of worry about lots of different things. So they might worry about academic pressures, they might worry about their health or health of loved ones. And that worry, again, is going to, and in order for it to like, it will start causing distress and interfering with things like paying attention in class or being able to fall asleep at night. And again, you can imagine if it's hard to concentrate in class, then you're missing what the teacher is saying, you're falling behind, and now that's going to spiral and cause other problems. If you're having a hard time falling asleep, you're going to be tired the next day, you're not going to be at your best, and that's going to spiral. So again, it doesn't have to be a disorder to require some sort of intervention to say, hey, you know what, let's get on top of this right away. And oftentimes with real anxiety, you might reassure your child things are going to be okay, but it doesn't work. Like that's not enough to calm them down, or it only temporarily helps at best. And then with social anxiety, I'd say that that's a big one that comes up related to school, where, as Lindsay was saying, like summer is a time where you're just kind of relaxed and you're kind of going at your own pace. The demands are less. And then all of a sudden you're being thrown back in to this school setting with people, some people you're comfortable with, many people you're not. And with social anxiety, there's this inherent fear of being embarrassed or judged. And that fear can come out in all kinds of different ways. It can come up in the classroom, being afraid of speaking up in class or wearing the wrong outfit, saying the wrong things, being afraid to play sports. And so the social pressures can go on and on. But again, underlying it is that fear of and avoidance. So what you want to pay attention to is how much is that fear causing your child to not do these things that they might want to do, but they're too worried about the discomfort or what's going to result if they do engage in that. Couple of other ones, Matt, you mentioned developmentally. So not very common, but something that we get asked a lot about is selective mutism, because it can be very confusing. It usually presents in the younger kids. And what happens is that the child will be unable essentially to speak in most venues outside of the home. So like, especially in school, they might show up, and it might happen like during transition to kindergarten, where they don't speak in the class, they don't speak to teachers. They might communicate via writing, but the verbal communication is just not there. But they might be very fun, loving, happy at home with parents when very comfortable. So they can feel very confusing, but that is an anxiety disorder. And I'll say another one, and then I'll stop. But another one that we've actually seen a lot more of lately is the fear of vomiting. And again, you would think not a big deal, but we've seen it cause so much impairment and school avoidance, where a kid will have seen somebody throw up somewhere, or and then develop this intense fear that it's going to happen to them. So again, it's one where it's just noting it, because I think often parents will be like, "Why? I don't get it," but it can cause a lot of impairment, and it's very workable. So it's important to just get them help and support to get through it.
So much good stuff there, Mona. Thank you. And I just want to particularly spotlight one thing that you said, which is the instinct that so many parents have when they hear about anxiety from the child, is say, it's fine, you're going to be fine, it's no big deal. And I think many parents will have heard back from their kids, you don't understand what's going on here.
Yeah.
And that expression of it's no big deal, or you'll be fine, or it's just jitters, is not actually, doesn't not produce the result in kids that we want it to have. Even when it's coming from a very loving place, it actually produces a sense of like, nobody understands what's going on with me. And I think if parents can replace that kind of response with a response of like, the first day of school is really tough. The first week is really tough. Going to a new school with kids that you don't know can be really, really scary. I understand if you're scared. Like,
Totally.
how are we going to get through this? What can I do to help you get through this? That kind of reframing towards this is a real challenge. Let me help you figure out how to navigate it is very powerful, and isn't necessarily the first instinct for a lot of parents. Harold, oh, please go ahead.
We often talk about wishing we had a different word for anxiety for the kids who like really get to that point of getting stuck and kind of overwhelmed by it, because we all experience anxiety to a certain extent. So I think we know what's going on for them, but we've even seen in some brain research, like these kids are filtering the world in a different way. Like their brains are interpreting, they're seeing threat in a way that's different from a non-anxious brain. And so when we try to just reassure them, it's not calming them, it's actually making them feel more alone and like no one gets it. And now they have to protect themselves even more. So could not agree with you more. It's the validating. It's like, I get it. Like this is hard. This is stressful. This is scary for you. You are not alone is a really important one.
Absolutely. Thanks. So that's a perfect segue to Harold. I wanted to ask you about particularly the kids that are cared for at the Child Mind Institute, who we know may have mental health difficulties, depression, anxiety, ADHD. Why is the return to school particularly challenging for those kids and their families? And how do you think about that?
Before we get there, I love the fact that Mona brought up two disorders that are more common than we think and still rare, and that's selective mutism, which is a kind of form of social anxiety. But you could understand why teachers who have a child like this in class, where you say good morning to a child, and this little girl or boy doesn't say good morning back, doesn't answer questions, you can see that maybe he or she whispers to her friend, and they can interpret that as oppositional defiant behavior or being a spoiled brat, or maybe the child's on the spectrum. Instead of recognizing that this is very circumspect, that if you literally looked in the window of these kids' homes, they are chatterboxes. They are perfectly okay when they don't feel that level of anxiety. But the other one of the fear of vomiting, it's exactly what Matt said. Saying to them, no, you won't vomit. It'll be okay. Just go to school is exactly the opposite of what we want and what therapists do, which is exposure response prevention. No, go for it. You could vomit. What's going to happen next? Oh my God, the room is going to fill up with vomit. It's going to be a sea of vomit. And after a while, the kid will say, are you making fun of me? No, but what will happen if you vomit? You know what I mean? How terrible it would be. And so exposures to, again, not right before they go to school, but exposures to these kinds of fears and recognizing that you can manage it is really important. I mean, at the Child Mind Institute, there's no doubt that for kids with mental health and learning disorders, they may have struggled in many, many previous years of school, and they develop anxiety around school in general as a result. It might not be separation anxiety or social anxiety. It's the fact that it is not a pleasant place. The specific challenges faced by these kids, depends on many factors. But if we think about it, for those kids with ADHD who have trouble sitting still, have trouble paying attention, particularly if it gets boring, have trouble waiting their turn, they may have much more flexibility in the summertime. Kids returning to school now have to deal with a whole new structure and schedule and significantly more rules. For kids who have difficulty with reading or with math or other learning things that their peers do not have, they're able to focus on things that they feel more confident on during the summer, whether it's swimming or running or playing baseball. And there might also be anxious about having to read out loud or do a math problem on the board or to take tests. And that's real. If you're struggling with those are things that are going to be difficult, and therefore you, as Mona just said, you're going to try to avoid them. For kids with social anxiety, and I really think the way to think about this is that the next time you have to go to a cocktail party with your significant other, and you walk into the room and you said, oh my God, I can't stand lawyers, and I'm dressed the wrong way, and I can't believe that who is going to talk to me? This is just going to be a disaster. The reason it works at cocktail parties is you go over and you have a drink, and the alcohol actually decreases your social anxiety. The problem is it's not a good treatment, because the next time around, you're going to need to double the dose. And so, but if you can remember that feeling of self-consciousness, of feeling not right, that's what kids have in social anxiety. And the other piece is they can't avoid it. You can avoid that cocktail party. But when you have social anxiety as a kid, you have to go to school Monday through Friday. You have to, do your first period, or you have to sit in that class. You're going to be called on. And there might be, the summertime, you're mostly with family or with very close friends. And so the fear of returning to a classroom full of peers where you may look foolish or look out of it is very real. And, certainly separation anxiety when leaving your parents after a summer together is also common. We've seen this now more after COVID. The kids, there was an article in the New York Times yesterday talking about absenteeism, that so many kids have gotten used to not going to school. And those anxious kids, whether it's anxiety about social anxiety or separation anxiety, they're really having trouble getting back into that routine. And, there's also kids who have both ADHD and anxiety, and they often have very low frustration tolerance. The fact that we don't think of anxious kids as having low frustration tolerance is the fact that if you are really panicked about something, if they put you into a spooky, scary house and you are convinced that someone's in that house, you're going to break down the door or climb out the window. And so anxious kids can sometimes look incredibly disruptive and intolerant to the fact that you're telling them to be still and wait until the anxiety passes. So patience and perseverance required in school and for homework can be very stressful and difficult, and can lead to acting out. And then there are kids who are on the spectrum and are often allowed very ritualized and self-directed behavior at home. So it's challenging for them to go back to school and not be allowed to do those things all day that gives them some kind of anxiety relief or some kind of, psychic relief. And therefore they may act out in school, especially if there's no accommodations for them. And remember, at school, we take tests. I mean, it's why it's so important that the structure of school is so important. But remember, Friday spelling quizzes. So test anxiety is very real for many children. They worry before the test, they worry during the test, they worry after the test. And for kids with learning disorders or ADHD, often already anxious about school, the anxiety can really spike before the actual test.
Absolutely.
So you're okay, Matt. Whatever you're ready to, Matt knows that I can go on and on and on. So
I'm learning. I'm enjoying it, but I want to pick up on a word that you said, Harold, and turn it to Mona, which is routines. And Mona, I want you help parents who are listening think about how they can use routines at home and the reintroduction of routines at the start of the school year to help to cope ahead.
Yeah. I mean, I will say that in our house, I'm so excited to get back to a routine and structure. I love summer and being able to be a little bit more laid back. And there's something nice about predictive patterns that allows you to kind of be able to have that chance together. And that being said, as Harold was saying, it's a transition. So it's important that we transition to that routine in a deliberate way, rather than just kind of saying, okay, we're going from completely loose to now we're in a rule-bound state. So normally I would say that start talking about and gradually getting into that new school routine about 2 weeks before school starts. I think those weeks have passed for most of us. But it's still early in the school year. So really thinking about how are we kind of making sure that we're really easing ourselves into thinking about structure as kind of the primary. And there are a lot of things we can do to help our kids kind of ease back into their routine. I'll kind of focus on a few because like Carol, I love it. Like I can also go on and on and on. And so I try to like hold myself back. It's just fun stuff to talk about when you see so much of it. And it's just, and when you can see how intervention can really help and make a difference.
Mona, that's exactly what I think is the point, that these disorders and these symptoms can be diminished or can be completely eliminated when the intervention is effective.
Totally agree. And so I think that's why it's so easy to feel so passionate, because it's like, I've seen over and over kids who've come to us and they're like, nothing works. And it's like, oh my goodness, no, you just haven't had quite the right approach. And then all of a sudden they're off to the races. So I'd say that though, we're in the end, we're wanting to empower our kids to be these independent, empowered adults. And so as we think about this, we want it like, even at young age, like we want to partner with them and show them that we respect how they think and trust them. I think, Harold, you had said, like, if we are super anxious and worried and show them that we don't trust them, how are they going to trust themselves? So I'd say first start by like checking in with your child. Ask them what they anticipate is going to be hard and what they think you can do to be helpful. So think about past transitions and what's worked, what didn't work, and then make a plan together. But remember, if you ask for feedback, you have to be open to what you're going to hear. I'll give an example in my own house. When my son gave me feedback that he didn't like my grumpy face when I woke him up for school. And my first reaction was, no, it's a tired face, kid, and I don't want to be up either. But then I took a moment and I appreciated the feedback, and I actually started to be more aware of how I was showing up. And honestly, like that little morning smile. So I purposely, I'm like, okay, like just put a smile on your face. It's okay. Like you can do it. Initially, I had to force it, but over time, it's actually become much more natural, and it like actually feels good too. And so again, it's really important to, if we're going to ask for their thoughts and input, that we're respecting it and really considering it. Which brings me to my second point, which it's already been mentioned multiple times, but I think we're going to probably say it many more times. It's check in about your own stress and how you're showing up. So how we parents and caregivers, how we model managing our own emotions really matters. And so make sure to pause and ask yourself, are you showing the behaviors you want to see in your child? And again, when you're busy and stressed and like moving in 10 different directions and everybody's calling you and asking you for different things, it is really hard to do that. And yet it is a very powerful thing to do. Check in, how are you responding to the kids when things aren't going quite as planned? Lindsay, you mentioned it this morning, right? Like one raincoat, like it is easy for it to feel like this disaster.
And Mona, you know, my husband, we are both child therapists and we can't do it, right? That's why we have hand signals. We have secret signals that we need to keep each other in check, you know? And so it's hard. It's very hard.
Yes, I know. I always say that I'm a child psychiatrist. I live and breathe this and think about this all the time. And I have to stop and deliberately remind myself about these things. And so it must be so much harder when this is not what you're constantly thinking about already. And then the third thing I'll say, and then I'll pause again, is just to set clear expectations for the new routine and call your kids out when they're doing a good job of following them. So like go through the ground rules as a family, because there are, like, again, the rules from summer to school are different. Don't assume your kid automatically makes that switch on their own. So be clear on what's negotiable and what is not. That one's been a big one in our family. And then establish what needs parent monitoring, especially in the beginning, and what can be left to trust and independence. Like, so some of these things that we've been talking about is like, when and where will homework get done? What's the screen time plan? When will friends come over? What is our expectation for family meals together? And how are we going to organize ourselves as a family? Like, are we going to have this like public calendar posted, or what are we going to do? But we actually have implemented a family meeting every Sunday where we just come together and it's a quick check-in of like, are there any things from our expectations that weren't going so well that we just need to kind of think through together? And it's gotten us in the habit of also just communicating with each other so that when things do go harder, we already have that habit of communicating.
We underline one thing that you said, basically catching your kids being good. You know,
Yes.
when they do what you ask them to do, don't say, of course, that's the expectation and they met it. but really underline it and saying, thank you so much for picking up your clothes, or thank you so much for being here on time and getting out the door. So we're going to be on time at school. I really appreciate you being so considerate. And I don't think most parents, certainly I wasn't doing that. And remembering to praise positive behavior, it very specifically really works.
Yeah.
And
And again,
feel,
oh, sorry, Matt.
please go ahead.
I was just going to say, and it's praising the behavior, right? It's not saying, oh, you're such a good kid, or
Right.
you're awesome. It's kind of, it's praising the behavior you want to see, so that they're like, oh, like this thing that I did, well, is something that I should do more of, right? So it's
Right.
being specific in what we're praising. Sorry, Matt, go ahead.
Not at all. I wanted to jump on that and say that I think that we forget as parents how taxing it can be to go to school and to make it through a school day, particularly at the start of the school year, particularly for kids who run anxious, and just letting kids know that we see their bravery and their determination and getting through a school day and coming home exhausted. And we can be dismissive as adults. You know, it's just school. What's the big deal? But getting back to Harold's analogies about just how big a mountain is to climb for some kids, and giving specific praise about how brave and determined and persistent they're being, particularly at the start of the school year, can be really, really reinforcing for kids. Lindsay, help us think about the balance that we hope kids can strike between having pursuits and passions and activities outside of school and having a chance to recharge and relax and just be kids when they're not at school.
Yeah, Matt, perfect transition, because being a kid is like a lot of work. And I think we get super dismissive of that. They don't pay taxes. They don't have to, they're not bringing home the bacon, right? But they are up early. They're in 8 hours of school. They come home, then they have homework. Like that's already more than the average American adult works in a day, right? And they're also doing sports, clubs, whatever. And we know that kids are getting more and more scheduled. And so it's a very personal family choice around how much activity and extracurriculars you implement for your kids, how structured their time is. But what I would say is, to just know and appreciate and keep in mind the value of unstructured time, the value of boredom, right? And the value of play, just free play. My kids are little still, but I count myself very blessed that I live in a neighborhood where they can literally run around between friends' houses. And I don't have to sign up for any after school activities or dance or art club or anything, because this feels right, and I feel very blessed that I have that opportunity right now. So, remembering that the downtime, the learning to tolerate the quiet, the getting comfortable with yourself as a human, with that may all come out as boredom, but that's like a very important life skill and something we really need to teach our kids to tolerate what comes up, to get comfortable with themselves, to figure out how to entertain themselves. The other point is that to remember that the first couple of weeks of school can feel a little easy, right? Like it doesn't ramp up until a couple of weeks in, until October. And so it may feel okay now, but it may get a lot harder as the school year goes on. And I think I see this particularly with college kids who all of a sudden it's October and, oh man, like I haven't done the one project that is my whole grade's dependent on. And I'm not used to the structure and independence, or I was so smart, that I was able to get away with not working all that hard in high school and middle school. And you're just in a hole by the time October comes. So really planning ahead, coping ahead. And then again, really modeling ourselves how we don't overcommit. We had a webinar about social media, which was, I think, our highest attended ever back in the spring. And, screens have become sort of, a very evil phenomenon. But dude, I need to watch some Netflix at the end of the day to chill out a little bit. Like after I've been thinking all day, it's okay to have some boundaried screen time, have some a chance to play some video game, read a book, play whatever, give yourself and your kids some downtime that is healthy and boundaried and restorative. you're muted, Matt.
Lindsay, thank you. So I want to talk a little bit about parents and schools. Harold, I want to know if you have any sort of pearls of wisdom around how parents can effectively partner with teachers and other school staff to help, particularly for kids who we know may have pre-existing anxiety or depression or autism spectrum disorders or other challenges. What are the ways the parents can effectively build alliances with their kids' teachers and other support staff at school?
So I think the one thing parents should remember is that teachers, you give me a teacher who's been doing it for 10 years and teaching third grade, well, they know 8-year-olds. And if they tell me that this 8-year-old is less attentive or more worried or more creative, that's a large sample size. And if a mom tells me that, I believe moms, but moms might only have one 8-year-old or two 8-year-olds. And psychiatrists have a very skewed sample. The people who come to see us are struggling with some kind of distress or dysfunction. So I think we really have to recognize that the teacher really wants, and the school really wants your kid to be successful. And a good partnership not only kind of ensures that, but it also helps if your child needs accommodations. So that if your child needs extra time on a test, if your child needs some special testing, if your child needs a special class because of certain behaviors, it is through that kind of partnership where you're going to be able to get the best for your kids. And I think the way to think about education, by the way, and public education in particular, it's kind of water going through a hose. And, I was one of those students who got B's, maybe an A-, a C+ every once in a while. I was in the middle of the flow of the water. They kind of leave you alone. And if you're misbehaving, you're hitting the sides. And if you're gifted, you hit the top of the hose and they pay a lot of attention to you. And if you really have lots of problems, you're hitting the bottom of you get the special education. But if we don't think of it as them getting our kids, but helping our kids, I think that's the most important way to partner. And if there's difficulty, if your child is really having difficulty getting to school in the morning, you should be talking to the teacher about how is he or she doing at school? I remember when my oldest son went to nursery school, he had a lot of trouble in the morning. There was so much anxiety. So the clothes didn't feel right. He needed to wear a certain baseball hat. And my wife went in for, the conference, the nursery school conference. And she said to the nursery school teacher, I have to tell you, every morning is a struggle. And the teacher said, well, not my Joshua. And my wife thought, no, my Joshua. But the fact is that the teacher looked at Joshua in a very positive way and basically said to my wife, I think his anxiety is about going to school, but once he gets here, he seems to be all right. So the hat's not that important. The shirt doesn't seem to bother him. And it was a great way to recognize that we need to partner. And also sometimes, by the way, schools don't see problems just the way I'm describing, where your kid is complaining that they're not reading as fast as other kids, or they're not able to answer the questions, and the school's not picking it up because remember, he or she is in the middle of that flow of water, and they're paying attention to the kids who are more symptomatic in different ways. And I think, again, it's a good time to say to a teacher, I think we have a problem here. Can you take a look at this? Because if I need to get a reading tutor or if the school needs to provide some special intervention, I think we should do it now and not wait. Remember, American parents currently wait 8 years from the onset of symptoms till the time they get some clinical intervention. That's a tragedy. And so if you see something and it's lasting more than 2 weeks, the partnership with the school is really important. The school is not going to kick you out. The school is there to have your kid thrive. That's exactly what they want. So I would talk about the fact that if your kid has any special needs, gifted is, gift for music or struggling with math, that the school and you should be in partnership.
Beautiful. Thanks so much, Harold. I want to pick up on something that from the introduction, Mona, and have you explain a little bit about your thinking with regard to when should parents say, you know what, we need extra help here. What are the signs and indications that you see in a child, not the first 2 days of school, but it's 3 weeks, it's 4 weeks, it's 6 weeks into school, and things seem to be not getting better, perhaps getting worse. Where would you suggest that parents say, you know what, it's time to get help here?
Yeah, and what I would say is that I would start. Oh, sorry, my phone started ringing. I would say that, again, anxiety happens on a continuum. So I wouldn't say it's a black and white, I'm either getting help or I'm not getting help. I think it's more of what am I doing to get, because parenting is hard. And you should never be doing it in a vacuum regardless. So if a concern is raised, if ask somebody about it, and maybe you'll start with a friend, or as Harold said, maybe you'll start with somebody at school. But I'd say that maybe you start by just kind of on your own, becoming like, be deliberate in noticing and tracking your child's behaviors and emotions. Like, how long have you noticed a change? What's changed? Are there little pockets of times, like in places where things are better or things are worse? How's it impacting your child? How's it impacting your family? Because sometimes the child is okay, but it's like the family is making all kinds of accommodations, and like the parents can no longer leave for work, and so the child's not distressed, but everybody around the child is. So again, it's just looking to see what the impact is, and the more clear you can get on what you're noticing and what impact it's having, the easier it's going to be for people to be able to try to be helpful. And I'd also say check with your child. What are they noticing for themselves? Do they feel things are going as they would hope? And where do they feel things could be better? Be careful about your tone and the expectations in the conversation, and like, just be supportive, be curious. And if they don't know, they don't know, and that's okay. So I wouldn't push, but I think it's okay to just be like, hey, what do you notice about yourself? Or sometimes you can ask in displacement, how are your friends doing? And you can kind of listen for what you hear through that. And then, as Harold was saying, I'd say my first stop is go to the school. And it's easier in elementary school because you have you have fewer teachers who tend to get to know the kids pretty well. But in middle and high school as well, the teachers they're astute, and they see a lot. They've seen a lot of kids over time, and so they can really help you understand kind of, yes, like what I'm seeing is kind of within range, or no, like here's some things I'm worried about. And more and more schools are hiring school adjustment counselors and school psychologists. So they might not know your child directly, but they're resources where you can go and sit down and talk with them and ask them what kind of, and they will have a little bit more context, at least, because your child is in their school and they can ask around. And then I would say partner with your pediatrician. I mean, the pediatricians are frontline. They see kids across the spectrum of challenges, and they can help put things in perspective and think together what the next steps would be. I'll say that I'm a child psychiatrist, and part of why we built InStride is like the mental health landscape is just so daunting as a parent to have to navigate. So trying to navigate it on your own is really overwhelming. And there are like school teams, pediatrician teams that can be really helpful, at least in just saying, here's what we've seen can be helpful. And it at least starts you in the right direction.
Well, Mona also mentioned before she has a Sunday meeting. And I think that Sunday meeting or a Friday night meeting, it really doesn't make a difference, but creating a ritual where you're sitting around without judgment and you say, well, how did the week go? You know, can you tell me if there's anything you're happy about? And you model the fact that there are positives going around instead of what's wrong with the picture. But it also gives you that moment where your son or daughter can say, I'm really having a tough time. I hate tomorrow. You know, it's Sunday. I can't believe it's already Sunday night. I don't want to go. You've now created a ritual, but also a space where there's safe communication.
Completely. Yeah. And it's one of those where it's like there's an openness to, and I'd say as parents, it's really hard. Like I sit with a lot of distress as a clinician, but when my own kids' distress is so hard to sit with. And so when my son or daughter will say, I'm just really sad about this interaction I had at school, it like breaks my heart. And I have to remind myself that there are going to be ups and downs. And as you're saying, like, how do we model being able to tolerate the range of feelings and knowing that we can handle them? And that being said, if we're noticing that they're kind of coming with this recurrent theme of like things being hard, or I don't know how to handle it, that's an important thing to recognize and to say, all right, we need to help you develop some tools to handle this more effectively.
Lindsay, I wanted to, before we get to some great questions we have from the audience, I wanted to see if you could reflect a bit more on helping parents understand the relationship between pediatricians and mental health providers, and how does that go, and how can that go well?
Yeah, you know, Mona, you touched on the mental health landscape, and this is why we built Fort Health. This is why you built InStride Health, is because we need to partner with pediatricians to better take care of our whole child, right? And so pediatricians now are screening for both depression and anxiety, and are often the first point of contact for parents who need anything, parents with questions about mental health and where do I go? How do I find mental health providers? Pediatricians they don't have the time or the resources to take care of all that, the mental health challenges that they're presented with. So, that's what we're really trying to do. I think in both of our organizations, all three of our organizations, is to really be a part of that equation and partner with folks to provide evidence-based care that has a start and an end, that is skills focused and education focused. I think one of the biggest things, if you take anything away from this webinar, well, just for me anyways, my three things would be modeling your own kind of distress tolerance and frustration tolerance, knowing that not all anxiety is bad anxiety, but also teaching yourself and then teaching your child the relationship between anxiety and your body. There is no other mental health condition that presents more prominently as physical symptoms than anxiety, whether it's headaches, stomach aches, racing heart, panic symptoms. And that pops up in the pediatricians' offices as well. And if you Harold, you and Mona talked about how treatable this is. Just that psychoeducation about what my body is experiencing as a relation to anxiety, and not, a heart attack or GI issues or a stomach bug. That is so empowering. So those are my three things to take away. And also, I think what presents a lot to pediatrician offices that we can be a great deal of help to.
Super. Thanks, Lindsay. I'm going to share with you all a few questions from the audience that are very specific questions, but I think each of these have great lessons embedded within them. So first, Mona, why don't we start with you with a question, I'm assuming from a parent. How do I motivate my child to go to school if they're catastrophizing and sometimes refusing to go to school? And I wonder whether motivation is the right frame for that, or what is the right frame?
Oh, I think, we talk about this all of the time, because, so again, Harold, you were painting that picture of going to that party where you don't know anyone, you're afraid of feeling judged, like the anxiety is rising, and you can avoid, like these kids can't avoid this thing so we're saying, yeah, go ahead, go feel completely uncomfortable for 8 straight hours, like you can handle it. And so of course they want to stay home, because staying home means they're comfortable. They're not feeling all of those big feelings. So again, when we say motivation, it's a tough word, because it makes sense that they want to avoid. And yet, in order to be able to first, show that the anxiety is not always accurate, they have to experience what they're afraid of. But also, they have to be students, they have to be friends, they have to be musicians, athletes, whatever it is, right? They need to develop their identity, and they don't do that by sitting at home all day. So this one, a lot of parents have a hard time with this, but we actually talk a lot about rewards. Especially in the beginning, where we put in a reward system saying, okay, anxiety feels huge. Let's break it down into smaller pieces. And let's come up with incentives, rewards, like what is going to help you feel motivated to face the fears, to be willing to be uncomfortable. And one thing we've done at InStride is we have coaches. And I will say that I love the role of the coach. The coach becomes like the cheerleader, the accountability person, the person that's like, I get it. And in order for us to move towards our goals, we got to take some steps forward. So with the younger kids, it's often like we're partnering with the parents in a lot of just asking the parents to remove some of their accommodations. What we find is kids who are staying home are often very comfortable at home. We have to make home less comfortable so that they're motivated to do something else. And as kids get older, we're more talking to them about what their value system is, what matters to them, and how is the anxiety getting in the way of their achieving what matters to them. So we go very values-based. And again, and all along the spectrum, but I would say that it really is breaking it down into smaller pieces and adding in rewards. And again, we talked about the specific praise, like everybody kind of rallying around the behaviors. When they show behaviors you want to see, making a bigger deal about that and really trying to ignore the behaviors you don't want to see.
But Mona, let's just talk about, rewards. I always amazed where a parent will say, I don't want to give them a reward. They're supposed to be doing this. They're supposed to be going to school. And I think we forget that when things are very onerous at work and we succeed, we get bonuses usually. People will say, it's amazing, here's a bonus. And recognizing that not everything is easy for everyone, and that, and the effort, it should be rewarded. So you didn't get an A, but you got a C plus, and you busted your butt, studying for this math test. I could see how much effort you put in. Let's celebrate. And there's, celebrating effort of going to school, giving them extra points for being able to smile at you in the morning, or not cry, or not negotiate. You say, not only did you go, but you went so nicely, you get 2 stars. Recognizing that effort really, and behavior, as you said before, but effort and behavior really have to be recognized.
Absolutely. So when we talk about school avoidance, we talk about not only what are they avoiding at school, and let's understand that better, but also like what is reinforcing at home. And oftentimes we're reinforcing some of the wrong things. Because when they're anxious, they're not they're motivated to feel comfortable. We have to motivate them to be willing to feel a little uncomfortable. And as you said, again, that effort is the big one.
There's an anecdote in the questions, and there's so many good questions. So I apologize to parents and attendees for not being able to get to many of these. But there's one that is particularly poignant for me. Lindsay, I wonder if you might respond. One person writes that their 10-year-old son just started a new school where he doesn't know anyone. He has a history of trauma, ADHD, significant anxiety. He was reprimanded by his teacher the first week of school for being rude by ignoring another teacher when she asked what his name was. His consequence was to have to write an apology to the teacher. I see this person writes, as perhaps selective mutism or social anxiety, how to support her son and educate the school.
That is heartbreaking. And I have to say, I saw my brother struggle with school anxiety and avoidance, kicked off by one sort of really painful interaction just like this. And so I think first of all, heartbreaking for this kiddo, and also balancing how hard it is to be a teacher, right? How hard it is to manage and know what's best for everyone. So I think this is a good example of just really trying to love and support that child at home, and also stick up for him, perhaps. We cannot rescue kids at all times, but we do need to step in where we're needed as their caretakers. And, this might be, just speaking briefly, this might be a situation where to protect that kid from just spiraling, like I've seen kids do, and I saw my own brother do, a parent might really need to advocate for that kiddo and just say, hey, listen, I'm not asking for special treatment, but this is the deal, and this is how he's impacted. How can we work together to, support him and respond to him in a way that's effective, and that is also getting the teachers what they need.
I think also it's very helpful if you recognize how the teacher was wrong, or that it was very painful. I have to tell you, in the old days when I was just a clinician, I would go to school to see kids that I was evaluating. And you would notice, particularly kids with ADHD, that the teacher would pick on them even when it wasn't their fault. The teacher had the back to the class, there was some noise, and the teacher screamed out, Mitchell, it's you again, and it wasn't Mitchell. And I remember that when I saw that kid again in my office, and I said, I have to tell you, Mitchell, it's a very mean teacher. That teacher is really, I would have a very tough time with that teacher. Years and years later, when Mitchell shows up, he's having trouble with his marriage and the business is going south, and he comes in to see me, and I haven't seen him for 25 years. He actually said, and I have to tell you, I knew you were on my side when you told me the teacher was mean. But I think parents should just have to, at times, to say, there's nothing we can do about this. The teacher's really in control, but you should know, I think the teacher's being unfair here. And sometimes we're just going to have to deal with this unfairness. But I can see why you were very upset. I'm upset by this too.
I mean, Harold, that was like a seminal moment for that individual.
And
That
I didn't,
intervention
the
lasted.
reason I'm bringing it up is I didn't know it was seminal until many years
Right.
later.
It's super
And
important.
parents, all of you, many of you are out here tonight asking really good questions about how to support your kids. And I think if you take nothing else home, please take home that your efforts to validate that your kids' feelings are real, even if you don't understand them perfectly, or even if it's not how you would respond, or even if you think they should do something differently, letting them know that you see that they're feeling something really strong is a very powerful message for your kids that gets planted deep down, and that's a really important seed to plant. And you don't have to be perfect as a parent. None of us. We've all shared some of our feelings as parents. Even in the last hour. But please know that effort to recognize that your kids are struggling, that this can be really hard. That anxiety, whether they call it anxiety, whether they call it fear, whether they call it nervousness, not knowing what to do. Sometimes they may express it as anger. Sometimes they may not yet have words for it. But whatever it is that they're feeling that makes a situation difficult, saying, I see that that's really hard for you, and I want to help you to figure out how to be successful. That is really, really powerful thing to do. I appreciate the immense passion and expertise from Mona and Harold and Lindsay tonight. Thank you for all that you brought to the conversation. I hope that folks found it useful. The webinar will be shared, as are all of the webinars from this series. Please come back and join us again. Please check out InStride Health, check out the Child Mind Institute and Fort Health. We're all out there doing our part to try to make these issues on our minds and to put in people's hands the tools they need to